So there's a lot of debate about whether you can or can't reverse type 2 diabetes and about the nomenclature that we use. Should we be saying it's in remission or should we truly say that it's reversed? I believe you can reverse type 2 diabetes. Now, the reason a lot of people believe that you cannot reverse it is they believe that a diet can keep it in check. But then if you revert back to your old diet, the diabetes would then rage on out of control. So let's go back and look at exactly what diabetes is. The definition of diabetes is having too much glucose circulating around in your blood. So then the thought process goes, well, if carbohydrates are made of glucose, and most of the glucose in your blood comes from what you eat, if you simply stop eating the glucose, that is, stop eating the carbohydrates, your blood glucose levels must be then well controlled, and therefore you don't have diabetes. Now, that part is potentially true in terms of the diabetes will be under control while you're not eating the carbohydrate. But then a thought process is, well, then if you just start to eat the carbohydrates again, then your metabolism must be as sick as it used to be and your blood sugar levels would go straight up to, terrible, terrible levels. You see, people with diabetes, they don't have the same ability to handle carbohydrates that an average person does because their insulin is not working properly. Whereas you or I, we might be able to eat 100 grams of carbohydrates and our blood sugar levels wouldn't rise too much. Somebody with diabetes, that would send it up into the stratosphere. But the interesting thing is that it's possible to reverse insulin resistance. And if you can reverse insulin resistance, then you can restore a normal ability to deal with carbohydrates that people used to have in their younger years when they were more metabolically healthy. And I do a test called a Kraft test on a lot of my patients. And that's where we actually get a drink, and it's of 75 grams of glucose. In other countries, it's 100 grams of glucose. I'm not sure what you use in India. And then what actually happens is you drink that and we follow your glucose levels over 2 hours. And the Kraft test is we also measure the insulin levels over 2 hours and see if they're also going too high or too low. And what we'll generally see is that people's ability to handle glucose over that 2-hour period after they've fixed their metabolism will often be back to normal. Their blood sugar, even when they consume the carbohydrates, their glucose levels don't rise anymore. And in those patients, I think it's safe to say you reversed their diabetes. Now, of course, if you go back on a crap diet, eating oxidized seed and vegetable oils and lots of sugar and stuff like that, can you unreverse the reversal? Of course you can. You can reverse the reversal. But it's fair to say that some people can truly reverse their diabetes with a healthy diet. And that doesn't just mean that only why they're eating a low-carb diet. It means you can also improve their tolerance for some carbohydrates. Well, it's not just a poorly controlled diabetic. It's anybody who consumes vegetable oils. It just affects poorly controlled diabetics worse. So vegetable oils, by their chemical nature, they have bonds that are prone to oxidation and prone to oxidation rapidly. So that means if it's been sitting on the shelf for a week or a month or 3 months, it doesn't matter. That oil in the bottle sitting on your shelf, if it's vegetable or seed oil, is oxidized. And when you consume it, your body absorbs these oxidation products. The first thing is when we absorb fats, they get absorbed into something called chylomicrons and they get transferred around our body through lymph channels and things like that. And these oxidized fats end up becoming a part of fats that get released by the liver, VLDL particles and LDL cholesterol, which you've probably heard about, that circulates around the whole body. And these oxidized fats, they're called lipid peroxidation, contained within these cholesterol molecules, get delivered to every corner, nook and cranny of the body, and they deliver their oxidation products. One of the biggest recipients of these oxidized products is the liver. And we've got very good evidence that drinking oxidized seed oils actually leads to fatty liver disease and contributes significantly to insulin resistance. And this happens in everybody. The problem is in people who are diabetic, because they're insulin resistant, their clearance of these oxidized fats is very much reduced. And that ends up with a much longer duration of oxidative stress to the body. It can take 3 days to clear oxidized products if a diabetic consumes oxidized seed oils. But having said that, even if you're not diabetic, oxidized seed oils are still not healthy. They've never been healthy. All the research, when we look at it with a critical eye, that research that's been done with a good methodology actually indicates, it tells the truth. It tells us that seed oils are dangerous. They just happen to be a little bit worse, or actually quite a lot worse, if you're diabetic.
Thank you, Paul. Paul, what do you suggest to the doctors and nutritionists who are not open to keto or low carb diets?
Well, it's not what I would say, it's what my patients would say. So I see patients every day who have been suffering in life with chronic health conditions. It can be joint pain. It can be just being overweight and having poor self esteem from that. It can be having low energy. It can be being diabetic and having the multiple consequences of being diabetic. So, kidney failure, multiple infections, heart disease, having strokes. These are real things that absolutely can destroy people's lives. And my patients come to me and they're just incredibly frustrated where that the solution for their multiple health issues has been obvious in the research for a long time. And they're outraged that nobody has ever thought to tell them that if they simply changed their diet, they could stop most of the medications, if not all the medications they're taking. They could lose weight. They could feel better. They could reverse their sleep apnea because they could reverse their kidney failure. They could reduce their risk of having a heart attack and a stroke. They could improve their memory. I mean, the benefits that people get when being healthy to being chronically ill is just amazing. It has an incredible impact on people's lives. And I think if doctors actually appreciated that there actually was a solution, and I don't know that doctors do it. Well, I know that doctors don't do it maliciously, but I believe they do it out of ignorance. And it's not good for the doctors either, because they get frustrated because they feel that they don't have treatment options for patients. The only option they have, what they've been taught, is to pull out the prescription pad and increase the dose or add something else. That's what medical training is all about. Medical training is not about giving sound nutrition advice and then de-prescribing. And I think if doctors were actually open-minded, the problem is we've all been led up the garden path. We've been fed a lie. We've had the food pyramid rammed down our throats for as long as we can remember, and we believed it. We've taken it on board. And it's very hard to consider that that might be a house of cards. It might be built on a foundation of sand. It might be completely and utterly wrong. And it absolutely is completely and utterly wrong. There's multiple pieces of evidence that the science has been completely and utterly misrepresented to the point where we now give dietary advice that is almost the antithesis of what it should be. And I think if doctors knew that, it would lead to much better outcomes for patients. And it would also lead to much more satisfying medicine. Do you know how satisfying it is to actually stop medications, to have patients come in and say, you know what, I don't need this medication anymore. I don't have any reflux. You know what, I haven't taken any anti-inflammatory this month because I have no more knee pain. This is incredibly satisfying medicine. It's win-win. I guess if you're a pharmaceutical company, maybe not, but for the people that matter, this can only be good.